when you get listed with the radical speakers of medicine because you think that food is important in health. And it's an interesting comment that amongst my peers at medical schools and hospital administrators, thank you, and practitioners, they're all wonderful and good-hearted people, but it's still a battle to talk about the fact that maybe our diet, our lifestyle, our fitness is linked to the development of disease. And if you play the record forward, why can't you play the record back? Why isn't it possible to actually reverse disease once it's identified by educating, setting up programs, immersing people, and leading them to understand the critical importance? I'm going to talk predominantly about food, and it's linked to cardiology and cardiac disease, but it certainly goes for active lifestyles, managing stress, optimal sleep, and we'll talk about some of that. But as I say, it's the saddest comment is that I'm here at all because it should be so ingrained. You know, we had, it's interesting, I'm going to go off on a tangent for a minute, but I also have a lecture next week in Tucson where I have to debate a cardiologist who believes we need to add more butter and cheese to our diet. I don't make that up. That's what he said in the New York Times 3 weeks ago. That's what he says in a new documentary. So I've had to dive deep into the literature. And until the 1950s, two things happened right after World War II, and I'll show you this. One was it started to be recognized that there were a lot of heart attacks in the United States. It wasn't really much of a medical problem before. I believe there were a few, but I believe it really did increase. And the second was that, I'll show you the data in a minute, but during World War II, you might think that European countries would have a rise in heart attacks. It's a pretty stressful thing to be living through the Nazi regime, and stress is a component. Well, there actually was a drop in heart attacks during World War II, and several smart observers noticed this in the late 40s and started to question why, and one question became, could it be the change in diet during those 4 or 5 terrible years? But anyways, the reason I even bring that up, because I will go over a little bit of that, is we've certainly had an inkling for 65 years that there's a critical role between what we eat and what diseases we do or don't develop. And yet, in 2016, at this wonderful gathering and conference, it's still a cutting-edge talk to present you the data I'm going to present you. So I hope this talk isn't needed next year or the year after, because there's greater recognition, but I just don't see that coming fast enough. Friends of mine in other institutions, Houston, California, and other places, send me pictures all the time of horrible hospital food. You know, and what do we do about it? I mean, some of them are employees of the system where they are at risk for speaking out and risk for activism because it's such a slow system. So 65 years later, I hope we're nearing the age of enlightenment where some of this stuff doesn't need to be gone over in such detail. But let's dive in. #1 killer in America, men and women. Projected that by now heart disease wouldn't be the #1 killer in America. Projected by now that cancer would overcome it, but it's like a race, horse race, and heart disease keeps staying just ahead of cancer because it's not dropping anymore. Heart disease was dropping in the last 25 years. It's plateauing. It may even be creeping up a bit. And I think some of that is the negative confusion and information, which is what I'm going to speak about more next week, but I'd be happy to take any questions on that. That's coming out and confusing the public, and we're kind of going backwards in a consistent message about healthy eating and reducing saturated fat and reducing butter. So we've got the public confused, and I don't know if that's translating into why heart disease is still #1. I'd hate to believe that because we'd have to pin this message on 10 or 20 people, and they're probably accounting for certain people's deaths and all, which is a rather awful burden to bear. But that's speculation. I don't know that. So, heart disease, many medical problems that can be presented, challenges, whether personally, everybody in the room should be concerned. 1 in 3 people in the United States will develop such severe heart disease they may die of it. So either the person to your right, person to your left, or yourself, don't look. If you're at the end of the row, it's a good place, I guess. Maybe that makes the odds worse. But it's really a big deal. I mean, this is a huge cost. Both from an economic standpoint, but from disrupting lives and families. I have so many connections now. I wrote a book called Dead Execs Don't Get Bonuses. Crazy title because I had given a lecture to executives, and they wanted to be provoked for a short lecture. But because of that, people email me all the time. I only wish my husband or my spouse or whatever had read your book and known about strategies to detect heart disease early, which I'll show you some of. So, I mean, I'm very acutely aware of the pain and suffering of young kids that no longer have a parent because of heart disease. And, you know, this is, as I mentioned, the pointer doesn't show up well on the screen, but you can get the point that somewhere around the 40s and the 50s, people started commenting that, you know, we're admitting people, we're doing autopsies on people, we're caring for people with heart attacks and other forms of clogged artery disease that we just didn't see before. And then it appeared that it, you know, peaked and it's come down a bit for a variety of reasons. Some are education to the public and health issues. Some are coronary care units and advances in medication and treatment. But this remains, as you can see, deaths in the United States, hundreds and hundreds and hundreds of thousands. It's about, I live in Detroit. We have University of Michigan Stadium, the big house, the biggest in America. We put about 107,000 people in it every Saturday when there's a game in Ann Arbor. And I think about the fact that you can fill that stadium 7 times and everybody's dead, and that's how many people die of a heart attack and heart disease in the United States every year. It's such a phenomenal, you know, idea to put your hands around, because these are all real people with, you know, real issues and such. So the enemy is a couple pathological pictures here, but we have this wonderful system, 50,000 miles of arteries through our body. Some are large, like the aorta in our chest and abdomen. Some are smaller, with many generations down to, you know, our fingertips and beyond, until they become capillaries, and then they change into veins. They're dynamic. There's a lining called your endothelium, which you want to keep very healthy through healthy eating and lifestyle and avoiding smoking. And there's clear data that high saturated fat diets damage your endothelium. Processed foods damage your lining of your arteries, called your endothelium. This endothelium, if you were to rip it all out, because nobody thinks about this, it would cover 8 tennis courts. So you've got 50,000 miles of arteries, but 8 tennis courts of this special wallpaper lining that, if it's in good shape, it makes nitric oxide. And I was also of the group calling it nitrous oxide. I thought it would make you laugh, but it's nitric oxide. It's incredible gas that your body will make when you take good care of it, avoid toxins, eat well, sleep well, don't smoke, watch air quality. Excuse me. But you can see here the consequences of pathology. It could be genetics. There are people that have genetically high cholesterol. Maybe we used to say 1 in 500. Looks like it's more like 1 in 250 lately, but that means 249 out of 250 people don't have a clear-cut genetic cause for arteries to get progressively clogged. It was actually in 1913, little history, a Russian researcher named Anichkov looked at this for the first time as coronary artery disease and clogged arteries becoming more frequent. And he looked in there and he said, it's cholesterol. It looks a lot like butter. It looks a lot like margarine, but it's cholesterol. And that observation in 1913 was followed by some experiments where he took rabbits, fed them high saturated fat diets like butter, and the rabbits created these plaques. So we've known, again, for more than 100 years that diet, some of you may accept that, some of you may challenge it, but certain diets raise your cholesterol, high cholesterol in the blood. We know this for sure from the genetic diseases. If you are born with a genetic disorder where your cholesterol is 400, 500, or 600, you may have a heart attack at age 10. And I've cared for people like that who were just genetically disadvantaged. But most of us don't have a cholesterol of 400, 500, or 600. But 300 is worse than 150, because Anichkov taught us in 1913 that the constituency of these arteries is cholesterol when they get clogged up, and other components. There is no sugar in these arteries, and sugar excess in the United States is a problem. It clearly leads to diseases and augments obesity and all, but it is not the pathologic substance, and that sometimes gets confused in the current kind of controversy that might show up on the cover of Time magazine and such august medical journals. Another one that actually looks predominantly like egg yolk or butter or cheese, but it's a severely clogged artery looking a bit like a tree with rings of age, as progressively gets narrowed down. And of course, at that point, somebody may feel bad and be at risk for that suddenly clotting off, causing a heart attack or death. Well, the general feeling was, until a few very brave souls questioned this, that from birth we have clean arteries, 50,000 wonderful miles of pathways to deliver oxygen and nutrients to tissues. But sadly, it is known, particularly if you're down in the Louisiana, Mississippi, Alabama area, and you take children age 10, 11, 12, and you run a little ultrasound on their neck is the typical way, you can actually start to see clear-cut changes of atherosclerosis, hardening the arteries even in young teenagers. We know by the time you're about 20, if you're a soldier in the Korean War, if you're a soldier in the Vietnam War and you die of trauma, and there's an autopsy, you probably got what might be called fatty streaks or other forms of atherosclerosis clearly formed, and then by middle age, it progressively narrowed, and then hopefully not, but the chance that an artery would be severely narrowed, causing a heart attack, stroke, loss of leg, and such. And the idea was, if you look at the arrows, is it only went in one direction, that it was inevitable, that it was to some degree aging. After we learned that it wasn't just aging, and that was in the 50s and the 60s, when things called risk factors. We realized it wasn't just aging. Did you smoke or not smoke was a factor. That wasn't clearly understood for heart disease till the 50s and 60s. You know, the way you ate, which is still the controversy going on, was a risk factor. Whether you had a diagnosis of diabetes, high blood pressure, and plenty of relatives at a very young age. So the arrow always went towards worse and worse, and that was the accepted convention, except for a few people and a few brave souls that are usually not discussed and in the standard medical world, but need to be celebrated and need to be taught because of the huge potential that we can go up the scale, not just down the scale, with this very serious condition that can rob us of our energy, rob us of our sexual ability, rob us of our ability to enjoy life, and actually take our very life. So this was one of the pieces of information I mentioned in the introduction, but this is from the country of Norway, and if you see the years on the bottom, on the x-axis, that there was a consistent rate of dying from circulatory diseases, largely heart attacks, through the 20s and the 30s into about 1940. And that was very carefully documented. They had, one of the problems with studying countries is, are their death records accurate? Is there even a death record system? The country of Mexico didn't have much of a system like that until the 1970s, but Norway did, and there was this tremendous drop in deaths due to cardiovascular disease, sort of the opposite, the oxymoron of what might be expected due to the stress. And then it rose and returned to normal. And as certain bright observers looked at this, they said, you know, people were smoking, people were living in about the same area, but one of the first things the Nazi regime did is they took animals out of the communities, took them back to Germany for the soldiers, and left people to forage in the forest and eat off of whatever they had in their garden in the backyard. And it was well documented that animal food consumption went down significantly in countries like Norway. The northern European countries, Finland, Norway, Sweden, tend to eat more animal products and a higher saturated fat diet than southern Europe, Italy and such. And it may be the growing season, maybe just tradition and culture. So when you take animals out of Norway, you're left with a whole new diet plan, which is subsist on roots and vegetables and seeds and legumes and such. So people looked at this when it became available and started to question whether this could be a therapy. Now, this is kind of a funny slide from 1939. You'll see there's clearly the wrong Morrison. I didn't make the slide. I thought it was kind of fun that they put that in there. Somebody has a sense of humor. But I'm going to go through it just real quickly because these are the radicals that challenge the system to say what should be so obvious, that the way we eat can contribute to disease, and controlling the way we eat might be a pathway to resolving disease. And I'm going to go deep on a couple of these. But Walter Kempner, if you ever have the time and you're interested and you want to read some of the most bizarre medical stuff in your career, you want to read about Walter Kempner, who was a German Jew that escaped Germany just before World War II, was taken in, he was already quite a renowned researcher, was taken into Duke and established a lab doing research. And during that research, I identified the hypothesis. He didn't know about this Norway graph yet, because he started this actually during the time period of World War II, that if I eliminate, I'm speaking as Walter Kempner, I guess it'd be if I eliminate, it was a very heavy accent when you watch anything from him, if I eliminate fat from the diet of patients at a time there was no medical treatment of high blood pressure, there was no medical treatment of kidney failure, there was essentially no medical treatment of diabetes except for insulin when it was available. If I eliminate fat from the diet, I believe I can reverse some of these diseases. He set up a clinic at Duke called the Rice Diet Clinic. Some of you may have heard of it. Celebrities, Elizabeth Taylor, Buddy Hackett, because it went on for decades. But he was a very careful researcher, and he documented, and then he published in peer-reviewed medical journals. So this was not some guy that didn't have a system of recording. These dramatic cases of children swollen with edema from kidney failure that 3 months, 6 months, 9 months later were essentially brand new. People with diabetic eye disease that was robbing them of their eyesight, that by eliminating fat from their diet, documented by photographs. Even people with very abnormal electrocardiograms at a time that cardiology was early and crude in its conception, but that you could see improvements in electrocardiogram. What he fed them was crazy. He fed them white rice, sugar, and fruit with very little vegetable. And he believed that that radical diet, it was a very difficult diet to keep them on. The original program was pretty much a locked building at Duke. Ultimately became a little bit more resort-like. He was very famous for being very stern and very difficult with his patients, occasionally said to beat his patients. If he ever saw them eating anything outside the norm, he'd throw a few scraps of chicken on once in a while. But the data came out of his work, and it caught people's attention for whatever his personality quirks. And this went on for decades, and there's many books written about him. And you know, he's sort of dropped off the map as one of the fathers of diet, you could say diet heart hypothesis, diet diabetes hypothesis. But his work was known, and then this work about Norway was known, and then a physician in Los Angeles, again, somebody who sort of dropped off the map, Lester Morrison, an internist, had a large practice of heart disease patients. Again, in the 1940s, heart attacks started coming on. Executives, it was largely a male disease. It was, you know, the big meal, the stress, the smoking, which was prevalent. I'm sure there were women having heart attacks in the 40s, 1940s, but probably at a young age. It was largely men. And he designed a diet. I'm going to show you a little more data in a minute. It wasn't Jim Morrison. And asked the question, if I modify the diet of my patients with severe heart disease, can I improve their outcome? At a time, essentially no clinician in the country was doing that. I'll move just quickly to mention Roy Swank, if you've ever heard of a Swank diet. But he was the chief of neurology in Portland, Oregon, an academic neurologist who, studying a variety of sources, again asked the question, if I drop animal fat, it's well known again that multiple sclerosis is more common in northern countries. Some people think it's the diet, the sun, the vitamin D. He hypothesized, a comment I made a few minutes ago, there's a lot more animal products and animal fat, saturated fat, typically eaten in northern countries, in Europe, and even true in North American continent. And he designed a diet, and he followed people for 50 years with multiple sclerosis, carefully documenting and publishing improvements and stabilization of their multiple sclerosis. There is still much to be read. If you have friends, colleagues, or know of anybody with multiple sclerosis, they should clearly read about the Swank diet. The main criticism of his work is he was studying multiple sclerosis before there were MRIs of the brain, and that is now the gold standard of assessing improvement or not, or worsening. Very recently, Dr. John McDougall in California published a small study where he showed stabilization of MRI. He couldn't show improvement. Clinically, they did improve, so it's still up in the air. 1960, they have Ancel Keyes there. Some of you know that name, some don't. I could talk to you about him for 10 hours. I'm a big fan, but he was born in 1904 in California. I ended up getting a PhD at Scripps in marine biology. Went to Cambridge, got a second PhD in human physiology. Quite an accomplished researcher, and in the late 30s was recruited to Harvard Medical School, not a bad place. He was actually at age 18, they just introduced IQ tests in the state of California. He ranked #1 in all 18-year-olds in the IQ not a bad accomplishment. But he quickly returned to his hometown of Minneapolis and started studying a variety of human conditions. First, actually starvation, because World War II was just embarking, and the U.S. government used his data for refeeding populations when they liberated countries in Europe. Ended up publishing like a 1,300-page book on starvation that is still considered the database for almost all knowledge. If you've heard of K rations during World War II, he developed that little packet of, I think it was 3,500 calories. I'm fine, but if somebody wants to bring me water, that'd be great. And then Dr. Keyes noticed the same phenomenon what happened in Norway. Thank you so much. And he got very interested in this idea that diet and heart disease. Thank you. He was a PhD twice. That's good. And he designed a study in Minneapolis of executives and showed that the higher your cholesterol in Minneapolis, the more likely you were to have a heart attack. And then he hypothesized to the world that he thought there was this connection, and he took a lot of heat. And then he designed what it says there's something called the 7 country studies, which was a phenomenal first time in the world study of very different populations: Italy, Finland, Crete, Japan. Does what you eat make a difference in your risk of heart disease? Actually, those studies are still ongoing. They just published last year 50-year follow-up of the 7 country studies. Almost everybody's dead. Let me just move on. Nathan Pritikin, you may know the name, another just radical thinker, because that is what the theme of this conference is, think outside the box. Nathan Pritikin never graduated college, living in LA, multiple patents. He was working for the government on radar and other things. And he heard about Lester Morrison, or Jim Morrison, whichever you like, a few shots over. And he heard that he was using diet to treat heart disease. He was curious about it. There was heart disease in his family. He was about 40 years old. And he went to Dr. Morrison and he said, "Can you check my cholesterol?" At a time, cholesterol was just starting to be checked. And his cholesterol was over 300, Nathan Pritikin. He was famous for eating hot dogs, ice cream, butter, good American diet of the 1950s. And then he went on a treadmill test and realized, by the report of Dr. Morrison, you just flunked your stress test. You're in your early 40s. You must have very bad heart disease from your very bad diet. And he dived into the literature, which was his style, reading everything he could, and came up with a program of eating essentially plant-based, vegetarian, low oil, walking every day, and very quickly was able to demonstrate that he had reversed his abnormal stress test. His cholesterol fell down. This is years before we had drugs that managed cholesterol. And he ended up in 1976 opening a center in Santa Monica to reverse disease, wrote a book that sold millions of copies, and became quite a well-known hero that many people relied on. And I won't go into George McGovern, but he tried to get the American government in 1977 to say that meat was bad for you, but the meat and dairy lobbies beat him down, and he never got elected to another public position again after that. So you have to be careful where you speak and who's listening and where the money is. So early stuff. This is Lester Morrison. It's a little busy, but it's so interesting because the cardiology world is totally unaware of this early pioneer. Reduction in the rate of death in coronary disease by a low cholesterol, low fat diet. 100 cases of people who had a heart attack either were put on a low-fat, low-cholesterol diet or told just do whatever you want to do. After 3 years, their weight went down more if they were on this low-cholesterol, low-fat diet. Their cholesterol fell from 300 to 220 on this low-fat, low-cholesterol diet. Again, people will say dietary cholesterol doesn't matter. You'll hear that all day long in the blogger world. Well, I don't think Dr. Brian Clements would agree with that on a panel we'll have later today, and Dr. Morrison disproved that 65 years ago, and patients felt good and their clinical status improved. What did he tell them not to eat? Creamy soups, liver, brain, kidney, pork, fatty meat, fatty fish, fatty roe, whole milk, whole cream, whole cheddar, egg yolk, kind of the sweets of the baked goods, waffles, cakes, muffins. It was so ahead of his time. Egg yolks, pies, frozen creams, concentrated fats. He wasn't much a fan of olive oil, but it was the whole gamut. You can't pick out the one thing here that may have helped these patients more than the others. Interestingly, if you look at the last line, olive, nuts, and avocados, and some people ask, why does some of the future researchers, I'll tell you about in a minute, avoid olive, nuts, and avocados? And it pretty much goes back to Dr. Morrison. He just wanted to get as much animal and to some degree plant-based, tropical, oil-based, saturated fat out of the diet. These are the stunning results he published. Again, basically lost. We're always excited about the new data. We forget about the old data. But if you look at 12-year survival, the low-fat group in red and the control group in blue, 50% were still alive in the low-fat group. It's for a disease at the time that basically had no treatment. It's pretty remarkable. So Lester Morrison, forgotten. He lived into the 60s. He's written a few books. I've got one of them in my bag I'd like to read because he's kind of new on my radar map, but we'll give him a shout out. And then just a brief little bit on what might happen in the Pritikin program, and I'll tell you why I bring it up. But he would typically invite people with obesity, blood pressure, blood sugar, cholesterol, or heart disease problems to eat a nearly plant-based diet. There still is a Pritikin program in South Beach, Florida, as well as now around the United States. I'll mention that in a minute. It was a very low-fat diet. Very big numbers over the years. He opened this in 1976. Was very careful in accumulating the data. In just 3 weeks, cholesterol would fall by 25%, triglycerides would fall, and body weight would fall, blood sugar, blood pressure. He ended up accumulating enough data, just to bring it up to date so you're aware of this, that in 2010, the Pritikin program had so much data on heart patients who'd been through the Pritikin program and then were tracked in terms of outcome. And it was demonstrated that if a person with heart disease went through this Pritikin 3-week program, the cost of their future heart care, hospitalization, maybe bypass, maybe heart attack, maybe stent, medications, was far less than the control group that didn't attend the Pritikin program. That Medicare approved the Pritikin program as one of the 2 programs in the United States for heart disease management and reversal that exist. I'll tell you about the other one in a minute. But to this day, there's dozens of programs. You don't have to go to just South Beach, Florida. We just got our first program of this type opened in Michigan, in Ann Arbor, a Pritikin cardiac rehab program. It takes a dedicated team and physician and dietitian, maybe psychologist, to really educate a group of people on this. So it's very, even though it was in the 50s that Nathan Pritikin started this journey, 60 years later, it's a very viable and alive program. It's not completely plant-based. They allow a few meals a week. There may be skinless chicken and fish, but it is, as a new book came out recently, it is veganish. It's very close. That's a so back to the fact that these are pressing matters because we still are dealing with so many, and these are some ancient figures I showed you, but what can we do with all these people that isn't just another medicine, another procedure, or another fatality?